And move us along. We have a very full agenda this morning. So we'll get started with introductions like we have been. So if you're just joining, please do put your name and organization in the chat and let us know if this is your first meeting. And then we wanted to start with community announcements as well, going over some of our recent updates. We're going to have the Texas Health Institute share about some of the evaluations. So thank you to all of you who have responded to those surveys and key informant interviews. Lots of valuable feedback on how we do this work together in the Health Equity Collective. And then we're going to move into, I'm sorry?
Please mute yourself if you're joining us, or put your comments in the chat.
Thank you. We're happy to make space too if you want to share in just a moment. Then we'll go into our priorities and what are the areas of focus for this year. And each of the work groups will provide updates. We'll also provide an update on where we are with the closed loop referral demonstration project and that progress, as well as the work in the community health worker ecosystem to close out. So that's our agenda for the next 2 hours. There's lots of it and lots of folks here to share. So I want to say thank you to each of you who are contributing to the presentation here today, and to each of you who are taking time to be a part of this event. Thank you and welcome. And first, we want to turn it over to you all. We know that there's a lot happening in the community. We've experienced some serious storms. We're looking at summer with school just getting out, and a lot of things happening in the community to support and promote health equity. So I want to pause here and invite anyone with events coming up, or new resources, perhaps supporting kiddos as they're getting out of school, or response to the storms as well, or the like, to come off and share. You're welcome to come on camera and share what you and your organization are doing, or put information in the chat.
Hello, everybody. Good morning. This is Jonna Dominguez with Harris County Public Health. I just wanted to share that Harris County Public Health, they're going to be hosting a Wellness on Wheels mobile health event. It's going to be happening in Sunnyside Health and Multi-Service Center. This is something great that you can share with the people in the community. I'll be sending in the flyer in the chat. And there's going to be a lot of fun stuff, breast and cervical cancer screenings, low-cost mammograms by appointment only. There's the phone number that the community members need to call, free vaccinations, dental screenings, HIV and STI testing. So it's going to be this Saturday from 10 a.m. to 2 p.m. And like I said, I'll drop the flyer on the chat so you can let the community members know. Thank you.
Wonderful. Thank you. Thank you.
I'll jump in and just say that yesterday, this is Shrila Sharma. Yesterday, we hosted a payment pathways webinar at the Center for Health Equity, and the webinar is one of 2 webinars, but this webinar specifically focused on what are the payment pathways for consideration for non-medical drivers of health, and reimbursement pathways. And we've recorded the webinar. We'll share the webinar with the group, and we'll send an email out as well to the Health Equity Collective members with the webinar recording. And there will be another webinar this fall as follow-up as well on that. So just wanted to share that. And while I have the mic, I'll also share there's a crowdsourcing webinar today hosted by the Texas Consortium for Non-Medical Drivers of Health that follows nicely with the webinar we had yesterday. It's got crowdsourcing for policy approaches to the upcoming legislative session for reimbursement pathways for non-medical drivers of health. And we'll drop those links in the chat for folks to register. Lisa has her hand up.
Please jump in, Lisa. Thank you.
Hey, everyone. Just real quickly, wanted to let everyone know that this is Lisa Albert from NBHP, and we're having our first symposium coming up on October 12th, the Act for Mental Care, focusing on access, coordination, and thriving in mental health care. And so I will put the registration link in the chat. It's going to be October 12th at the Council on Recovery. We are also having Ryan Leaf, who is a retired NFL player, struggled with his own addictions and mental health related issues. He's going to be our keynote speaker. And so I'll put that information in the chat. Thank you.
Thank you. Thank you. Leland?
Good morning. Sorry, just had to unmute. Hi, I'm with the School of Public Health, but I'm also a volunteer with Mums Demand Action. And tomorrow is the beginning of what is a called Wear Orange. It's a gun violence awareness and prevention campaign. And in Houston, particularly, social determinants of health, policy, mental health, access to care, it's all related to gun violence. In case you didn't know, gun violence is the #1 cause of deaths in children and youth in America. It's appalling. And so Wear Orange is a way to honor victims and to let people know that this is a preventable problem. It is only in the US. Other countries do not have this problem. And to me personally, it's everybody needs to have an awareness and do something about it. So I put in the chat links, and you can, if you go on the link, the wearorange.org link, there's how to participate. You put your zip code in and you can see what events are there. They're generally fun events. We're in the Rio Grande Valley. I'm organizing poetry and singing and proclamations and stuff like that. So just want to make people aware. Thank you.
Thank you, Leland. That's very important. For those of you in Houston, I don't have the link directly handy, but the Baker Institute actually has a gun violence symposium tomorrow, Think US, which I think will have a lot of really great speakers and information on how to prevent gun violence injuries.
Melanie, do you want to go next?
Sure. Good morning, everyone. So just wanted to really start off by reminding folks that June 3rd was the beginning of summer feeding for children. And as we know, Texas did not put a summer EBT program together this year. So it's really critical that we're trying to connect families to summer feeding programs in the state. Many school districts are participating this in June. But there's also numerous community organizations. We have a kickoff on Saturday. I put the link in the chat to just bring awareness to these programs in our region. There's a comprehensive list on the Houston Food Bank website, as well as a calling 211 to make sure that you can connect families to these programs. We see a huge decline in summer participation, and we also know high rates of child food insecurity. And so this is one avenue we can continue to promote. And then just quickly, secondly, to Heidi's comment around the storms, we are still seeing the impacts of families who have been impacted by the recent storms, unfortunately 2 in some cases, back-to-back storms. And so the Houston Food Bank is specifically just wanting to ensure that organizations that are supporting families, if there are opportunities where you want to serve as a disaster partner to help families in need right now, we would love to connect with you and ensure that you have resources for families who may have lost SNAP benefits or who may have just need additional services. We know that is critical right now. So happy to connect. And also we have on our website a list of locations for individuals to go to who are looking for specific services as it relates to the recent weather events.
Thank you so much, Melanie. Haley?
Good morning, everyone. This is Hallie Goldstein. I'm also with Harris County Public Health. I'm with the Preparedness and Response Division. So just two quick things. In follow-up to the Wellness on Wheels event that we are having this Saturday, there will be our Harris County Public Health Connect team out there. So they will actually be there to help folks apply for FEMA. And they can also help folks apply for their SNAP benefit replacement. In addition to that, we will also be giving out mosquito repellent because we know these mosquitoes have been relentless since these storms, and some additional disaster supplies as well. So the Wellness on Wheels event, even though it is in Precinct 1, it is open to anyone. And then just a follow-up to the violence prevention information, Harris County Public Health is also having our violence prevention conference next Tuesday and Wednesday. It is free. So I will be putting the information in the chat. And yes, mosquitoes have been taking growth hormones. That's hilarious. So yes, I'll share the information on our violence prevention conference as well in the chat.
Wonderful. Thank you. Thank you. Bill?
Yes, I just posted in the chat a LinkedIn post on the Kempe Center's virtual conference coming up in October on a call to action to change child welfare. And a lot of the focus is on systematically addressing social determinants of health and system change. And they're expecting thousands of people from around the world. So it should be a good, affordable way to learn on different things to help families in crisis.
So is that a global event then?
It is. It's largely, they expect people from over 20 countries, but I think the vast majority are from the US and Canada.
Okay. Thank you for that.
Should we move on? And folks can continue to put stuff in the chat. We'll be
Yes.
sharing all of this wonderful information out.
Yep. Yep. Sounds good. Thank you all. Lots of important things happening. So we know we have a few folks who might be new here. So we wanted to start with just a quick recap of what are we doing here together as the Health Equity Collective. So the collective was launched in December of 2018. It grew out of a former coalition. And really, as you can see here, it's a multi-sector effort, really looking at how do we promote collective action and improve systems. We're looking at the non-medical drivers of health, and primarily healthcare, nonprofit, government, and academic institutions coming together. We've got 7 work groups, task forces, focusing on different things. You'll hear from each of them here today, and their leadership comprise the steering committee along with UT Health. Dr. Srila Sharma and I are both at UT Health and serve as the co-leads, and UT Health serves as the backbone organization for this, particularly the Center for Health Equity within the School of Public Health. And as we started out, we had a group of about 40 leaders in our region who really spent some dedicated time. They actually did a global literature review on frameworks to guide this. It's really complex stuff, right? So to guide, how do we work together? And that's this framework for achieving better health together. And I'll just do a quick overview of it. I know many of you are familiar with it, but I think it's important to ground our progress with our framework. So looking here at the darker blue on the bottom, the drivers of health, the systems that are, how our societal values inform our policies, both at the institutional and public level. And then how the policies in turn inform our living conditions. And when you look at these living conditions, they're very broad still. And then how the living conditions inform behaviors and health outcomes. And those are both at the individual and the population level. And then we ask ourselves the question of what can we do together as many organizations, there's more than 200 organizations now within the Health Equity Collective. What can we do together better to improve our communities? And that starts with being grounded in the communities and community voice. So we have a work group focused on that specifically, and building out strategies to respect and uphold community voice as we look at how to promote health equity across our region. And then these buckets of action around that of health and social services coordination, cross interventions, advocacy practice and policy change, as well as the intentional research, evaluation, and learning. A lot of this systems work at promoting health equity and addressing the non-medical drivers of health. The science of it is still developing. And so we're being very intentional on relying on the science that exists of the evidence base of how do we do it right, and also contributing back to that. So you'll hear and see that. I also want to point out, as we look at how our work for 2024 is organized, it's organized by these buckets of action at the top. So when you look at our logic models and actions, they're organized by these segments of what are the activities that we're doing in these spaces. And then a quick nod and just thank you from the bottom of our heart for the leaders from these organizations who comprise our steering committee members for the 2023-2024 cycle. Really appreciate all their leadership and expertise on being dedicated to this shared work. We continue to grow, y'all, and that's exciting. And even as we grow, we're looking at ways of how do we build connections and engage all these folks who are now following our work. How do we build out those linkages? So as I shared a moment ago, there's more than 200 organizations. Our intranet, so to speak, with the Health Equity Collective now has over 1,000 members, and our LinkedIn followers. When we did this when we started these slides last week, it was 1,678, but I got a message yesterday, we actually hit over 1,700 LinkedIn followers. So there's really steady growth there. If you're looking to join any of the work groups, as you hear about all the work that we're talking about here today, there's the link for the form to sign up with any of the work groups. And then, of course, you're always welcome to just reach out to us and talk more about it. And then we've got our website, LinkedIn, Twitter, and that last link is that Mighty Networks site as well. And our communications work group will have more to say on Mighty Networks in a little while. And we have had some transition and some key leaders who have done so much for the work of the Health Equity Collective who have stepped back to make room for others. So just want to take some time to acknowledge Suzanne Jarvis, Michael Walsh, Nicole Browning, Sean Haley, Melissa Dono, Alan Watkins, and Robert Morrow for the leadership that they contributed over the past several years in their respective work groups. Really appreciate everything that you all have brought to this work, and celebrate the accomplishments that also you've brought to our region in so many aspects of how do we promote health equity together across our region. And with that, also want to welcome, we have several new members coming on to the steering committee, and we've got Melanie McGuire with Houston Food Bank, who's stepped up as co-chair for the Food Security Work Group, Iris Sines with Memorial Hermann, who's co-chairing the Policy Work Group, and Lisa Albert with a network of behavioral health providers who's co-chairing the mental health and substance use work group. So thank you all for stepping up here. We're really excited for what you'll bring to the work that we're doing. And with that, we're going to jump in to how are we doing? Before we go into the work that's been underway, I want to pass it over to the Texas Health Institute and for them to share the work that they have done in guiding evaluation of the work of the Health Equity Collective. So with that, I'm going to pass it to you, AJ Jacks, to talk through the results of the of this developmental evaluation.
Thanks, Heidi. Can everyone hear me?
We can.
Great.
Yes.
So good morning, everyone. I am pleased to say that we have wrapped up this project as much as you can wrap up a developmental evaluation, because it is very much an ongoing process with the Health Equity Collective, and we have some really interesting findings to share. But before we do that, I want to talk a little bit about this project that we just did and what is a developmental evaluation. So if we can go to the next slide.
Sure.
So at Texas Health Institute, we pride ourselves on having a fairly robust evaluation team with some experience and expertise in several different types of evaluation. But the type of evaluation that seemed to fit where Health Equity Collective is right now and where it was when we first started working with the collective is a developmental evaluation. And really what developmental evaluation boils down to is taking that skill set of evaluative thinking. So the skill set that evaluators have in their head that they use to evaluate programs, and bringing it not in a way that thinks about, well, is what you're doing good or bad? Are you meeting the outcomes that you want to meet or not? But really thinking about how to help an organization, an initiative, a collective grow and develop when it is fairly new, when it is really emerging in its process. So then when you do get to the point where you are ready to do that process evaluation, where you're ready to do that impact evaluation, you've already had those conversations along the way, so that it's more likely when you get to that point that those will be successful. And so that's really the approach that we took to this developmental evaluation. There was, the typical framework and research questions that we started out with, but all along the way, we were partnering with HEC to figure out, well, what are the questions that you really need to know answers to as you move forward, as you grow, as you develop, to help you make that development successful. So what did that timeline look like? Let's go to the next slide and see. So we started working with some data that already existed, analyzing it. And this was about, I would say, a 2-year process formally, but the relationship goes back longer than that. And I think that's really what made this developmental evaluation successful, is that THI was already part of some of these conversations when we started doing this evaluation. So we started looking at some existing data, data that was already collected, particularly on the community health worker program, started attending the HEC meetings. And we did all of this before we really got into the formal evaluation process. And then what we started with was 2 phases of research. So first a survey and then a key informant interview. And then we did another survey and another key informant interview. And the second phase really allowed us to go back and say, well, what have we heard since? What has happened since? Where do we really need to invest in terms of our time and our evaluation research to understand what the next steps are for the growth of the Health Equity Collective? So let's go to the next slide. So we have some new findings from our most recent round of key informant interviews and our most recent survey. So we're going to start with the key informant interviews. And one of the things we really wanted to talk to folks about is their understanding of what it means to be a committed member of the Health Equity Collective. And we found that it really varies. For some people, especially starting out when you first start coming to these meetings, it's really about showing up, actively listening, and participating in the best way you can. There is value in hearing different perspectives, hearing from different sectors, and hearing across silos, and setting that safe space for folks to be able to share their experiences, even without going beyond that sort of good follower, good listener role. And that is one way that folks commit. So another way is to really think about the strategy, the vision behind Health Equity Collective. Another level is really contributing to improvement of the Health Equity Collective, thinking about the structure and the processes and how they can continuously be improved to make the collective stronger, grow the impact, and make it a better collective to serve all Houston residents, and then also bringing new opportunities, whether it's projects, funding, or further collaboration. So I'll let you guys read the quotes there for just a minute, but I think they really encompass some of these different perspectives on what commitment means. Okay, let's go to the next slide. And there was positive feedback on allowing for this varying level of commitment, but also, again, with that spirit of continuous quality improvement, some folks who are ready to kind of move forward and think about the collective a little bit differently. So it may be that, some folks just come in and they're really focused on their own interests and they come in and out, and that the collective provides a space for that. But then there are these super committers, and making sure that there are roles for not just the super committers, but also the folks who are, like thinking about it, not sure if they want to be fully involved in leadership, but are wanting to develop and wanting to think about what that might look like. Of course, everyone is coming to this not as their main role for the most part. This is something that folks are doing on top of the work that they are already doing because they see the value of it. They see the potential of collective impact. And so allowing for that commitment based on people's interest and based on people's capacity is really important. There was a note that the structure is more flexible than other collectives, and there are both pros and cons to that. But suggesting that folks look out and see what other collectives look like, what some structures could look like, and exploring whether that is a way that HEC would like to go. Certainly, as HEC has grown, its impact and the awareness of it has also grown, and that increases commitment. It's a reinforcing circle where folks hear about it, they hear about the good work, they are more willing to be committed. And again, that safe space for people to bring their concerns, to have those conversations that are sometimes a little bit tough and sometimes bring in different interests is really, really important. I think making sure that that safe space extends not just from these full group meetings, but into all of the work group meetings, and also making sure that there's a little bit more clarity and focus and structure, just to help move to the next level of development where folks feel like they can really work together on shared measurement, on shared goals is really what people are hoping for, at least the key informants that we talk to for the next phase of the collective. So again, I'll just give you a minute to read some of these quotes. All right, let's go to the next slide. You will, of course, have these slides available to you after this presentation. So since engaging in the collective, one of the major impacts that folks could see around the region is that equity was becoming a conversation regionally, but also within member organizations. And that was really one of the major findings in terms of if we were just to think about impact right now and outcomes right now, that was something that folks could really identify as something that the collective has made a difference on. Also that breakdown of silos, willingness to have those conversations, and thinking and being creative and willing to engage in pilot initiatives that you might not otherwise because you have some partnership that has evolved from the collective. All right, let's go to the next slide. So I think this was just a really great quote that points to all of the growth and all of the exciting things that are happening at HEC and all of the commitment that y'all have made to make it a great organization, or not organization, a great collective. So if I mentioned HEC before, it used to be people saying, what's the Health Equity Collective? What is that? And now when I'm talking about it, people say, well, is the Health Equity Collective working on that? And to me, that is just such a powerful message about how important the work you are doing and how impactful it is in the region, even at this early stage of development. Okay, so going back a little bit to the partner survey, I will say, you know, the response rate on the survey is not what we would have liked, but we do want to be sure that we are honoring the voices who did take the time to complete the survey. So let's go into it and take a look. I think one of the nice things is that even though it's a lower response rate than we would have liked, it does mirror what we're finding in the key informant interviews and in the prior survey phases. So I think there is some validity to it. So let's move forward to look at the survey results. So looking back at the phase 1 survey, we noticed that folks really mentioned the communication efforts by the Health Equity Collective and a desire to hear more and learn more, and then also more opportunities for collaboration and shared measurement. So with that in mind, we developed out the next survey. So this was actually conducted between February and March. We had a little bit of delays, you know, just coming back from, you know, the holiday break and getting the survey out. As I mentioned, it's not what we would love with a response rate, but we did hear from all of the different work groups in the collective. So that's at least good. We've got some representation there from different groups. So some of the highlights. People do feel like there is trust building that is happening. They really mentioned that the in-person and face-to-face opportunities really help build that trust. And less so in some of the other opportunities to connect, but the folks who talked about, you know, what different opportunities, they didn't want to get rid of the different ways of connecting and just move only to those face-to-face networking opportunities. So we'll see that in the next slide. So 70% of our respondents are actively collaborating on initiatives and joint strategies, funding proposals, and trainings were some of the things that were mentioned. And people do want those in-person meetings, but they really wanted a mix of both because we're busy and we can't always make it to an in-person meeting. So having that mix of both allows for customizing what does the experience look like. You can really focus on connection in person and focus more on information sharing when you're in a virtual environment. So people really agreed that communication efforts are effective. We also heard this in the key informant interviews, and that there were some recommendations to, you know, maybe do some more formalization of what communication looks like. So an annual progress report, including work group goals as part of every meeting, and then sending reminders with links to the work group files, just to make sure people are getting those prompts to go back and think about the goals and move forward on those. Okay, let's go to the next one. So really, I think what it came down to is that what was recommended was already really in progress. So that's good. That affirms that the direction that folks are going is really the right way to go. And we love to see that. So in terms of connecting with the community, folks felt like keeping those regular and ad hoc updates, communicating that shared purpose, deliverable, sending out the deliverables and making sure that there are action items are really crucial to help people understand what's happening with the collective. So I think the biggest thing that we saw is, as I mentioned at the beginning, you know, this is work that folks are doing on top of their work that they do in their day-to-day jobs. And it is so important and people see the value in it, and that is why they come here. But making sure that there is that space to disconnect, reconnect, making sure that that is always considered when planning, when thinking about ways to develop leaders in the collective is really important. There was some movement, but again, we had a smaller response rate. So I'd love to hear what folks on this call think about this. But potentially reorganizing steering committee meetings. I know that is a very specific group to prioritize discussions on driving change in health equity and really focus on that strategic impact. Okay, let's go to the next slide.
I think that concludes.
That's it. So I did have just, and I know we're running out of time, so we may not have time to this, but as you're thinking about these results in the chat, if you want to share, you know, what here resonated with you and what maybe surprised you about these findings, I'd love to read it in the chat.
Yeah, AJ, thank you. Very helpful. And Chris, yes, we'll be sharing these out. We also have a full report of the findings that we can share. So really appreciate Texas Health Institute for your efforts in gathering all this input and analyzing and sense making of it to help us inform how we move forward and where is it that we focus. You know, there's so much work to be done in this space, but where is it that we focus our attentions? And with that, we're going to move into where are we going and what is the focus for this year? And I'm going to pass it to Dr. Shrila Sharma to start out with looking at how did we organize it? So here's another one of our lovely graphics.
Yeah, we love our logic models and theory. But, yeah, I just want to say that we take all of the input very, very seriously. We've been and really appreciative to THI for doing this evaluation. It was important that it helped guide a lot of what you're seeing here. And just to orient everybody else, start top to bottom. So we wanted to just make sure everybody understands sort of what is the structure and the infrastructure available to support the health equity collective efforts. What we clearly saw in the slides that were just presented is how hard everybody's already working. And the collective only is successful because we all come together. So the success of our work depends on everybody's engagement, right? And we want to co-create those shared agendas to move the work forward on the social drivers of health in our region. But to do it, we also recognize, as we saw in the evaluation, we recognize that it requires a certain level of support and infrastructure, and we want to commit as the backbone organization in being there to support these efforts and bringing those resources that are needed. And so one of the things we did was just take a step back and sort of lay out what is the infrastructure available to the Health Equity Collective to move the work forward, and from a backbone organization perspective. And so we wanted to just share that in full transparency with everybody. This is where we are for 2024, right? We are always learning and want to be nimble and always reevaluate as we go. This is the work we do together, so it's not, Heidi and I don't want to and intend to make any decisions single-handedly. But we also want to make sure that everybody understands the strong level of commitment from us as an institution. And so the Health Equity Collective administratively sits within the Center for Health Equity, which is one of the research centers at UT Health Houston School of Public Health, and it sits within the Department of Epidemiology. Heidi and I have the privilege of serving as the backbone co-leads of the Health Equity Collective, and then many of you serve on the steering committee. I'm just going top to bottom if y'all can follow me. Many of you are serving on the steering committee of the Health Equity Collective. Again, without our membership and the commitment of each of you, this work just would not happen. And then on the very left side are the work groups and task forces that all of you are involved in some form or another. One of the things we took a step back in thinking about how we can best support the work in 2024 was with our communications efforts. And that's because everybody we recognize is already in the business of doing. 10 years ago when we were, or 6, 7, 8 years ago, for our region, there was work happening, but it was sort of in small silos, and we were still thinking, do we want to screen for non-medical drivers of health? Or there was still just a lot of thinking going on. Now we've gotten in the business of doing. Literally, every organization that I intersect with is very excitingly now in the business of doing work around non-medical drivers of health. So we've come a long way in a very short time, but what that also means is that the same people are now being pulled into 10 different conversations, where 6 years ago, there was one conversation happening in this space. So we do understand that, one, there's limitations around time, but we also understand that there's a lot of hunger and desire to just learn from each other. What are we doing? And what is the work that you're doing? What does that mean to my organization? And how can we align and coordinate to push each other's efforts together? The magic happens when we can each achieve our own individual organizational agendas while pushing each other towards success, because we all are working towards the same common goal, right? We want to address non-medical drivers of health and improve health equity. So that's the good news. We've all aligned in that direction. But how do we make sure that we are building the space to learn from each other? And that's the middle box that you see there, is that we are really amplifying the communications part of the work that we're doing. And I just want to give a huge shout out to our communications work group that has continues to take this on. Wes Gibson, Alicia Johnson, you'll hear from them in just a little bit on all of the incredible work, and it's listed here that they've been doing. And also our community voice work group, because that's sort of centering, right? That's how we operationalize our work, keeping community voice at the center of it. So that's sort of the anchor in regards to the work that we will be doing within each of and supporting each of the work groups with. So for example, in food security work group, if there's conversations happening around stigma, and we want to make sure that we are building out a communications structure around that. So for example, on June 28th, we've invited Dr. Allison Carpin to present on the work of food insecurity and stigma. So for every work group, we are building out what the communications approach would look like and providing that backbone support through our backbone organization. So that's the very right box that you see there is we have actually an internal communications group. And these are not just folks who have communication expertise, but these are folks who also have programmatic expertise, community development expertise that are providing that administrative and operational support to the Health Equity Collective. There's several folks on here who that are providing that incredible level of support, including also data. I don't want to undermine the piece around data research and evaluation as all of these efforts are coming alive as well. So we wanted to just share this out with you. A big part about our efforts are also going to be centered around spotlighting our partnerships efforts in these spaces. So we'll be reaching, you'll see us reaching out to y'all time and again, asking to spotlight your work so that again, we can communicate and have sightlines on what each other is doing as well. As we move into at the very bottom, as we move into 2025, there are some considerations for us to sustain this work, right? And so we will be exploring that with our steering committee and others as well in regarding really thinking about the sustainability of this work and different efforts that are happening within the work groups and the task forces as well. But for 2024, we really want to create a space for building those sightlines around learning, building action, collaboration, and partnership. So that's the big piece that we are focusing on building the infrastructure around. Next slide. So we've also fleshed out the role of our steering committee. I'm not going to read this out, but essentially our steering committee right now consists of co-chairs of the work groups and also expert advisors and Heidi and I, as well as the backbone co-leads. But we wanted to share this out because this is a leadership opportunity. We want to foster that next generation of leadership in this space, and so this is also a call to action for those of you who may be interested in supporting the work groups and the task force efforts. Please reach out to us. We want to be a big part of our work is cultivating that and fostering that next generation of leadership as well. We have fantastic co-chairs. Heidi and I are always blown away by the level of commitment from our steering committee and co-chairs, but we also want to cultivate that future leadership as well. Next slide. We have these are all you can click on these links and get involved. That's the big you will see our logic models that we put together for all of the work groups and all of the activities that are happening within the work groups. You can sign up. You'll hear from the work groups. You can sign up for different things as well, and different work groups as well. You'll get this presentation via email shortly. We highly encourage everybody to just get involved and get into the action of and the business of doing this work together. It has, just personally speaking, this has been an enormously fulfilling, didn't fall squarely into like the research bucket of the world I've been historically involved in. But I cannot tell you, I cannot imagine doing research without the engagement in the Health Equity Collective anymore. It's just a fantastic space to grow your, grow your knowledge. Next slide. I'm not going to reiterate this, but essentially just want to point out where the infrastructure support for the Health Equity Collective. We want to reassure everybody that this is a commitment from us as an institution that we will continue to support this work, and not just support it, we will build on it, and we're here for the long term. Next slide. If y'all want to learn more about, and you're wondering, well, what is the Center for Health Equity? We have the QR code here. You can learn about, Health Equity Collective is one of the core infrastructure efforts of the Center for Health Equity. We recognize that without a strong infrastructure around health equity from a regional standpoint, it's very hard to then build and have strong interventions and programs and services. And so our center is very much committed in investing in this infrastructure effort as well. So feel free to also reach out to us. We have our emails on there. If you have any questions or want to engage in any of the spaces as well, we welcome all of the above. Next slide. And with that, I suppose I'll pass it to our fantastic communication work group. Alicia.
Hi, good morning, everyone. Alicia Johnston here. I've had the privilege of serving as the co-chair of the communications work group since we launched in 2020. But I met the Health Equity Collective, Heidi, Srila, and I see Tanwir joined a little while ago, who were the backbone leaders when I joined in 2019. And to Srila, Dr. Sharma's point earlier, I really can't imagine doing this work now without this group, truly leading the way. And really bringing visibility to health equity and non-medical drivers of health and all the work that's happening in our region, but also getting that national recognition, which we saw in the Texas Health Institute slides previously. So presenting with me today will be Wes Gibson, who is our co-chair. And I also want to just give one more shout out to Melissa Dano, who, we served in the trenches together for quite some time there in the beginning, and really helped build the brand. As well as just the presence for the Health Equity Collective alongside all these organizations who are here on the right side of the slide. Next slide, please, Heidi. So since the beginning, the communications work group has been focused on building awareness and increasing engagement, not only just with the work of the Health Equity Collective or the work groups, but also with what's happening within our community, regionally, statewide, and of course, making sure we're staying abreast and connected with what's happening nationally. We don't do this work alone. You've heard it said many times if you've been around for a while. The collective is really about connecting dots and amplifying the work and the people that are doing this important work. So how do we measure awareness and engagement? So the measurement piece has really, come to life, I would say, in the last 6 months or so. Wes Gibson has been doing just a phenomenal job of pulling together data dashboards for us, because there's just so much data out there between LinkedIn, our Mighty Networks platform, which we'll talk a little bit more about. But in terms of awareness, it's really, that those followers, the members, that's really what we're focusing on. So with LinkedIn followers, you can see well, Heidi mentioned earlier, we're up to 2,000 now. When we built these slides last week or the week before, we were at 1,667. So you can see there's that steady growth. That bar chart at the top right, you can see just that trend. We are looking at, when we're seeing those upticks. So we're digging a little deeper to understand, what do people want? What is getting people's attention? Same with Mighty Networks. So we use Mighty Networks to store our events and, just share different resources, a lot of which we will promote from the chat today. We'll share on Mighty Networks as well. But that's how we get people, from that LinkedIn or that more public facing or worldwide type of facing into our specific community or network. In terms of engagement, that's where we're really looking at. It's more than just about raising awareness. We want to incorporate people's voices. We want people to be at that decision-making table, and we also want, folks to take action. And so we're looking at contributing members on Mighty Networks. These are unique members who are liking, sharing, attending events, as well as those total contributions. So number of contributions overall for all of those members. Next slide, please, Heidi. So how do we, promote that awareness? How do we increase that engagement? We bucket the work in three sort of areas. So the first, all the way to the left, is those networking sessions, which we'll again dive a little deeper here in a few moments. We have the online and in-person engagement activities, and then developing different communication plans and strategies. So starting back at that far left, we launched those virtual networking sessions in September 2020. It was really around a response to folks wanting to be engaged. We were in the middle of the pandemic. We were, we couldn't have our breakfast tacos anymore. People wanted to engage. And so that's when we started framing up this idea of how can we bring people together, amplify the work, talk about the issues facing our community, whether it be food security, vaccinations, gun violence. That was another hot topic for a while there and continues to be. So we started, again, September 2020. We've held 39 networking sessions to date. We've brought in over 75 speakers across our region, across the state, and bringing in more national leaders as well, just making sure that we're staying connected and staying abreast of what's happening outside of our region as well. We see steady participation in that. 50 to 100 folks are participating monthly. And so we're looking to evolve that work. So how do we take all the content, those 39 sessions, and how do we put it in a more digestible, how are we storing that and then presenting that to folks and then building off of it? We don't want to just do these sessions and then store them away. We want to continue to revisit these topics and dig deeper and also keep up to date with what's happening, how the work's evolving. So we'll show you a little bit about how we're reorganizing and rethinking that work. And thanks to Nadia Siddiqui for her input and support with that as well. We're also requesting input from folks. We want to, again, incorporate more voice and, in terms of how we, what we think about in terms of what we present, the topics to speakers. So Susan, if you don't mind putting that networking session topic form, if you have, topics that you'd like to present, if you'd like to present the work that you're doing with your organization or invite someone from your organization or recommend them, please use that form because we want to hear from you. Online person engagement, Mighty Networks LinkedIn, we already covered that. So we're making sure that we're posting, that we're engaging weekly. If you have things that you'd like us to promote, we also have a communications ticketing system that Susan can post the link to. We can also share that out. We'll be promoting that more frequently. So we're using that to collect input from the work groups as well. But we want to hear from the community and the work that you all are doing too, and making sure that that's getting promoted through our channels. So we are also doing neighborhood learning walks, which you'll hear about in a few moments. Larissa Jacobs and Fit Houston is really helping bring the community together and supporting us with that. We do volunteer events annually, usually around the holidays. We've done 3 so far, 3 years running. So if you have ideas on what you'd like to do this fall, please let us know. Or this winter, let us know. And then we have no agenda gatherings. So we do happy hours, we do coffees, we do breakfast tacos now that we can. And so we invite folks to come to those. And then we, of course, have our structured meetings. So like those in-person quarterly meetings. We had one last year. We'll have another one coming up this fall. And then we'll also, we've also hosted learning sessions. Many of you participated in the food security learning session last year. Planning and strategies, I already mentioned the communications ticketing system. This is just to help us create more structure. We can't be in every meeting either, but we want to make sure that we're collecting the inputs from the work groups about the important work they're doing to making sure that we're building a robust communications plan for not only the collective overall, but also what's happening within those networking sessions. And we'll continue to use the data. I mentioned the dashboard that Wes created, so we'll continue to use that as inputs to continue to continuously improve the work that we're doing. So next slide, please, Heidi. And I'll pass it over to Wes. Thank you.
All right, and so this is highlighting some in-person events we've had. So Larissa Jacobs is the founder of Fit Houston, which is a nonprofit that promotes health by increasing physical activity and free outdoor spaces with free wellness programs to improve quality of life. What I want to emphasize, of course, is a great opportunity to get together people in person, but they also have a learning value to them. Especially I want to highlight a recent walk we had. Jaime Gonzalez led it, and I forgot the name. It's Madres del Parque. I forgot their exact name. But anyway, what this highlighted was the role of local advocacy. This is in the Gulfton area, which has a very international area. And her name is Miss Maria, who's in the yellow in this photo next to Jaime, the one by the apartment. And what she saw is that the park was not in good condition and that everyone deserves a spot to have leisure fun, to gather as a community. And a big part, she had a big role in really pushing the county government to invest in that park. And you go there and there's local art, there's a garden. And so during this walk, we learned about this and the role that just the whole purpose of this Health Equity Collective and engaging people in different organizations and the power of that movement. So of course, really want to emphasize just how this is just a big manifestation of what the Health Equity Collective is about and how it's an opportunity to learn and grow in knowledge as well. Next slide, please. Oh, and just so we know, everyone knows, in September, we have another walk planned near the Kashmere Gardens 5th Ward. We'll have details coming soon for that as well. All right, next slide. So for those of you who might not know, normally on a monthly basis, the communications work group hosts a virtual networking session that's centered around different topics. I definitely encourage people to show up to this next one, which will be this coming Thursday, June 20th. Dr. G. Bai will be speaking. She is an accountant and has a PhD in accounting, brings a really unique perspective. I also encourage you to follow her if you're not. She does a really good job she breaks down the economics of our healthcare system in the US in a really digestible way, but also gives really good feedback on ways it can improve. And so she's going to bring her expertise and talk about how that relates to value-based care and social determinants of health. I encourage you to join Mighty Networks if you're not part of it, but that's where we post the events and of course on LinkedIn as well. July is open, and we have one tentative session planned in October about food insecurity statistics and engagement with non-medical drivers of health in Texas, a mental health topic in September, and likely a volunteer event November, December. But yeah, I encourage you all to join those events if you're not and get involved with Mighty Networks. Next slide. So there's a lot of information on this slide, but this ties back to what Dr. Sharma was talking with the broader Health Equity Collective Communications is tied to the Center for Health Equity. Again, as the backbone organization, and I'm part of UT Health Houston myself. We support a lot of this work through our staffing, and so this slide will be available for reference. But we have a lot of the work that's going on is being circulated through publications coming up. We also have articles on our website. And so I just want to make this another nudge. If you don't know about the Center for Health Equity, I encourage you to visit the website. We have our projects here. We put updates, we put articles. And some of this just highlights what we've done from the Health Equity Collective side, especially with the community health worker efforts. We published a newsletter. Our work group leaders have presented, Backbone and work group leaders have presented at different events. Next slide. As well as presentations. And a lot of this will post on, we post on our LinkedIn page. So again, if I haven't said it enough, definitely encourage you to follow the Health Equity Collective on LinkedIn. And also just to encourage everyone here, doing that also leverages your strengths in your organizations and your work groups progress. This isn't just UT Health is a backbone organization, meaning we support it. So again, please, contact us. We have the ticketing system, and just make it a habit in your work group. If things are going on, ask yourselves, oh, is this something we could promote? We're doing this dashboard on LinkedIn because about LinkedIn and Mighty Networks to really just track where is engagement happening. and it's a good way to really evaluate the efforts. And so we're not just doing that for our work group, but for the collective as a whole. Next slide.
All right, so I've heard from several folks that they're having issues with accessing and logging in to Mighty Networks. And then also, we wanted to just briefly show you the new space where we're how we're organizing the networking sessions going forward, and then just provide a little insight into where the next phase of that might look like. So Heidi, is it okay if I grab the screen? Can someone please confirm that you can see it? My screen?
Yes, we can see it.
Okay, excellent. So whether you're grabbing the QR code or following the QR code or a link that we share on LinkedIn or in the chat today, or you find it on the website or one of our social channels, this is usually the landing page that you'll find. This is just our Mighty Networks landing page. It's the best way to go about coming in, sort of like the front door. I would recommend saving or bookmarking this page. When you go to the mightynetworks.com, there's a few extra clicks. You can still find it there, but this is the simplest way, is to bookmark this or download the app. It'll store the Health Equity Collective there for you. But if you have trouble finding the Health Equity Collective's Mighty Network page, this page here, you can go to healthequitycollectivetx.com. That's our website page. Heidi shared it earlier. You scroll to the bottom and it says request to join. It's a big button. You can't miss it. Click there. It'll bring you here. Go to our LinkedIn page. Go to our Twitter page, which is @HECTX. That is that's our handle. That'll take you, actually it's TEXAS. That one's spelled out, Texas, HEC Texas, and you'll find the link to this page as well. So bookmark it, please, download the app if that's what your preference is. But once you're here, if you're already a member, you know you signed up, go to the sign-in page. You can see I've stored my information here. The sign-in's not lit up. How do you light that up? Click on your password, and then it'll light up. I'm not sure why it does that, it just does. If you forgot your password, like any other site, you have a forget your password button. If you sign, what we see a lot is people leave their organization and they signed up with that account. So we always encourage people to sign up with their personal account just so it goes with you. But if you forget, create a new account and then just ping us, let us know, send us an email that you have multiple accounts. CSUN does an amazing job of pooling those reports. So if we can flag that and also reach out to you. But if you are aware that you have more than one account, just let us know and we can take care of that. You can also sign up using one like Google, Facebook, LinkedIn. It'll use that same login. So it's almost like the SSO or the single sign-on. You can use that method as well. So whichever you prefer. So let's go ahead and sign in. I want to show you this I'm drawing a blank on the name. Learn, Network, Contribute. That's our new space. So before I go there, though, I just want to talk about what it looked like before. So again, we had 39 networking sessions. And so similar to like a Facebook feed or a LinkedIn feed, it was just like this. So, sort of flat, not that the information wasn't being shared, not that it wasn't engaging, but there wasn't really a lot of structure to it. And so we're thinking about like the work that the Framework and Common Metrics work group that was led by Nadia Siddiqui and Michael Walsh, and just the incredible work that went into creating that framework. There's a whole framework section, by the way, channel here that goes over the evolution of that framework that Heidi presented on earlier as well. So we're just taking a look at how the framework is structured and how can we organize our networking sessions around that. So we're building on that work, we're building on that content. And so we created this space. It's called Learn, Network, Contribute. There's a button here, click on here. This just talks again about how it's organized or how we organize the content. and those speakers. And so you'll see a breakdown here to the left, or excuse me, or here of how each of the sessions, how we're bucketing those. So this allows us to just quickly glance on what's missing. Where do we need to focus our efforts to move the conversations forward? And so you can click on each of these sessions, find details about them. Some of them have videos. The more recent ones certainly do, because we're now on YouTube, where we weren't before, but we do have all of that content and have memorialized it here. So you'll find, when you scroll down, you'll find PowerPoint presentations, as well as how to build on your knowledge from there, how to connect with people. So we do capture and give a hat tip to all of those speakers and recognize them as well. A next phase of this work is we are going, instead of organizing this around the topics of the sessions, we're going to get a little bit more granular in that framework, and then we can show multiple sessions related to that topic using the definitions that Nadia and Michael and that work group came up with a couple of years ago, and then organizing the sessions around that. So it's just a little bit more continuous, and again, builds each session building on itself. So I'm going to stop there. I know I'm over time, so happy to answer any questions offline. Thank you.
Thank you, Alicia, and thank you for all your leadership and work in capturing that for our membership. I think it's really important. I'm going to go ahead and reshare. We'll move along. And pass it over to Iris to talk about the work of the policy work group.
Yes, hi everybody. Well, shout out to our communications team. They definitely do a lot of great work, and I learned a lot right now too. I'll say, like how Heidi mentioned, this is my first year serving on the steering committee and also as a co-chair. I've worked with the Health Equity Collective for almost 2 years now, after starting with Memorial Hermann Health System, one of the partner organizations, and lots of great momentum. And I'm excited to be able to be here and to build upon that for these next actions that we'll be taking. So I serve as co-chair with Jordan Pacelli. She's from the member organization Prevention Institute. She's unable to join us today, but if you've attended last year's in-person quarterly meeting or any policy work group, you've seen her leadership in action, and doing lots of great work there, and having a wealth of knowledge with the policy components that impact these health disparities. So my role at Memorial Hermann is I work on our government relations team. Memorial Hermann is committed also to doing our part to address these health disparities alongside our community partners. And I support our community benefit corporation and service lines to identify policy priorities that could address these non-medical health related needs or social drivers of health, social determinants of health, lots of different ways to talk about them, and especially here in Texas. So there's a lot of great work, like we've talked about, and a lot of discussion that happens within the policy work group, and in collaboration with the subject specific work groups that you'll hear about in a little bit, that will help to reach our goal to connect the coalition's SDOH efforts to these existing policy and interventions that are out there in the community. So it's not always does a new regulation need to happen. Not always does a new program need to happen. There's some great work that's happening by the food banks or other community partners. And so that's part of the component that you'll see whenever if you join our work group, similar to what happened today, different organizations that will share different happenings that are happening across the community to address, like was mentioned earlier, food insecurity, also to help people get replacement benefits. We'll talk about those things in the work group and share information that are requirements from HHSC. We talked a lot about the unwinding also during our work groups, and how many people we saw come off of the Medicaid rolls, and what does that mean, and how can we help them? Here you'll see we do this through collaborating and communicating. There's a lot of collaboration that has to happen, especially with some complex policy needs and addressing these non-medical health related interventions. And so working with members to see what's already happening out there, how can we address it? Like Srila mentioned earlier, there was a webinar that occurred yesterday that talked about different pathways to covering non-medical health related needs like housing or food insecurity. And there's complex things that are happening at the federal level and then also at the state level, and knowing what does our audience and what does it look like here in Texas, and talking that through. We know that we have divergent and different perspectives on how we can address those needs, and talking those through and coming together, finding commonalities among our groups of like, what priorities are you looking at this next legislative session, or to address a different intervention. A lot of those conversations are really great because I know I learn a lot from other organizations in different ways to be able to address those needs. So with that, as I mentioned, each meeting we open with a discussion on current opportunities and challenges and programs relevant to these SDOH, like those informational webinars or local partner efforts to assist the community. We also make a concerted effort to both collaborate, and communicate, like I mentioned, to identify those policy priorities and advocate for evidence-based policy solutions. The beauty of, I think, Health Equity Collective and having UT Health as our backbone organization is to have that information ready at hand of evidence-based solutions and the outcomes that we've seen. These aren't just ideas. We're working to try to make these things happen and create these interventions. And like Heidi and Srila were talking about, there's lots of great work that's happening already at the community, and highlighting that and how it does and how we can get broader support at the state or federal level is where we're focused on too. So the work group members during our meetings will discuss the policy implementation updates. You'll hear something similar to what we go through in just a moment from Lori Van Hoos. She'll be talking about the implementation of House Bill 1575. House Bill 1575 was passed last session, and it created a pathway for community health workers and doulas to get reimbursed for case management services. And we know community health workers are a great asset and do a lot of great work. And so this is one pathway to get them in as a provider and covered under Medicaid. And then besides that, that bill also, or the legislation now, required managed care organizations to screen pregnant women for non-medical health related needs and to coordinate those services. So this is one big step that I think Texas is making, and we're really excited to see how this all pans out. And Lori will provide some more information in a moment on the implementation. So I'd also like to talk about like what are we doing in anticipation of the 89th legislative session. All of that will come very quickly. Right now we're in what's called the interim. And so we're following the interim and talking about what different hearings are happening. We're talking about what are those interim charges that each of the different Senate or House committee work groups are going to be discussing, and what comes out of those. We'll be collecting also from member organizations their policy priority topics to identify those commonalities that we can build momentum on and advocate for collectively. And as I mentioned too, there's we value the differing perspectives on how to address the health disparities, because we know we're going to learn from each other. We may think one way, addressing it in a policy way might fix one part, but then there's also another piece that maybe we need to think about. And really enjoyed that part of the work group of discussing the differing perspectives and how we can address those, because there's not just one way to make a difference. Besides that, like I mentioned, these interim hearings, another thing that you can see that will come out of this is if you're planning to testify at an interim hearing, we're here to be able to bounce off ideas during the work group. We can help with reviewing the testimony or researching information to support what you're planning to share during that testimony and how that then connects to these addressing social determinants of health. During the legislative session, the work group will share information on filed bills, discuss their impacts, and potential advocacy efforts that are available to build upon or that we can develop. For instance, there was the Community Health Worker Advocacy Day. We talked about that. We had members that attended and were advocating for some of this coverage for community health workers. And we know that the work that they do in the community is very important. Some of the current policy priority topics that we follow are healthcare coverage and access, maternal health, mental health, and food security. Many of these topics, as you know, working in the community, they're interrelated and cover a broad range of interventions and potential challenges for the communities that we serve in the greater Houston area, which I know your organization likely has great expertise that can help further the work group advocacy work. So we definitely would enjoy having you come to one of our work group meetings and be a part of that and the conversation and share what you know and also what your policy priorities are. Besides that, we also work to have like statewide advocacy groups that will come and have conversations about maybe some research that they've done. So one example is Texas 2036. They did a report on who are the uninsured, and our goal is to have them come to one of our work group meetings, talk about their policy priorities and what that looks like and how we can leverage a statewide advocacy group and their efforts, because we can't do this alone. Besides the collective here in Houston, there's also bigger statewide advocacy groups that we can ask to help with us and our efforts. So we'll continue these efforts with our members to confirm these policy priorities and ensure that they're consistent with the needs of the community members that we serve. And again, we'd love to have you, and we'll have a slide in a moment after Lori's presentation with our emails that you can contact us and we can add you to the work group list. So to give you an idea of some of that information that we share, I'll turn it over to Lori Van Hoos to provide an update on the implementation of House Bill 1575.
Hey everyone, thanks for letting me join today. My name is Lori Van Hoos. I'm with Treaty Oak Strategies, and I am a consultant with the Physical Health Foundation, and we're closely monitoring the implementation of House Bill 1575. So just wanted to provide an update today to any of you that are interested or may not have been following as closely as we are. Right here, you see in front of you the timeline. I think this is the easiest thing to speak from. This is a slide from HHSC. So no reason to recreate their wheel. I'm just using this slide to kind of help walk through all the major steps that are taking place within implementation. So let's start, and I'll kind of walk you through all of this. So last fall, one of the big pieces of the bill does require that the agency develop a standardized set of screening questions for Medicaid managed care health plans to use to screen pregnant women. Health plans screen all new members when they come into their health plan with a set of health, social, psychosocial, mental health questions just to understand maybe the needs of that member and what additional services or assessments or referrals are needed. So these questions will be integrated into that screening. So last fall, the agency worked very closely with quite a few stakeholders and developed a list of screening questions. The screening questions have been finalized and were submitted and sent to the health plans earlier this year. and the health plans will begin programming their systems. Those screening questions are pretty standard. The agency used, evidence-based questions. So they pulled various questions from the Prepare screening, various other screenings that are out there, food insecurity screening. So it has several domains that you all are familiar with: housing, transportation, food, childcare, domestic violence. So those questions were finalized, sent to the health plans. The health plans are in the process of updating their systems so that they can ask those questions and capture the data, because the data has to be reported back to the agency so that they can submit a report to the legislature at the end of the year. To enforce those questions and to require the health plans to ask them and to submit that data requires a contract amendment to their contract. Contract amendments take place in September. So this September is when that will be in place. But we know, if we start asking the questions in September, there's not going to really be any good data for the next legislative session. So in an effort to try and get some initial data, the agency has asked health plans if they would like to pilot the questions. And so we have about 10 health plans that have agreed to pilot. It's going to vary how that pilot looks. Because, like I said, it takes time to program their systems to update it. So there may be some pilots that are manual. There may be some pilots that are just in certain regions of the state. But the goal of that pilot really is for the health plans to collect some initial data so that we do have some data to report to the legislature next session. Because the whole point of that data report is so that we do have some actual data that shows what is going on within the Medicaid program. I know we all know that there are definitely food insecurity, housing insecurities, and various other insecurities that Medicaid members face. But this data will give us, some solid information, and hopefully, we can see regionally what's going on and really what's going on with that population. So we're excited about that pilot. The health plans are working right now with the agency to implement that. The other big thing that is going on is the agency is updating the case management for pregnant women rules. That is the case management program with which doulas and CHWs will be able to provide services and bill. So those rules, we haven't seen officially them post, but they did submit a round of draft rule changes to everybody. It's very, very, very high level. The agency doesn't like to put a lot of detail in rules. They like to put it in the policies because rules take a very long time to update. And so there is a couple changes in those rules. We'll be seeing those officially post here, I would say, in the coming months. That'll provide an opportunity for official input that would go to the agency they have to respond to, and then also opportunities for testimony when those rules are presented in front of the various committees at the Health and Human Service Commission. So we'll continue to update you when we see those officially post. And then the other big piece that will take place really is around the enrollment for doulas and community health workers. As many of you probably are aware, Medicaid enrollment can be burdensome and clunky and, difficult for some providers. So the agency will be working to update all their systems and their rules so that later this summer and into the fall, community health workers and doulas can begin enrollment processes. One of the big things that we've stressed the agency and that the agency has agreed with us on is that there needs to be quite a bit of opportunity for training and education on how those processes work. So, the MCOs and the agency will be working together once that enrollment process is updated and finalized to get in front of the community health workers and doulas who are interested in learning more about what that process is, so they can learn that, with the goal of getting them enrolled later this year. And after enrollment is when providers can start billing. So we're hoping that by the end of the year, there will be the opportunity for community health workers and doulas to bill for that case management services. All of this takes time. It's systems, it's computer systems updating, it's education, it's materials, it's policies. So, we don't have solid dates yet, but we have some pretty good timeframes, as you can see on this timeline. And then the other big thing on this timeline, I will go ahead and outline too, is May 2024 was when the agency was anticipating the CPW training would be complete. So to participate in the case management for pregnant women and children's program and provide case management services, today nurses and social workers are the only two provider types But doulas and CHWs will be added. But to participate in that program, there is a training requirement, and it's a module, it's an online module that HHSC and DSHS work on to keep updated for those providers. And so they are working to update that training so that doulas and CHWs can go ahead and take that training if they'd like to check that box, because that'll be a requirement for enrollment. Last we checked a couple weeks ago, they were still working to get that updated. It had not published yet. I'll go back and check in with the agency and we'll give you an update, but I think they were hoping late May, early June. So that's where we are now. So we'll do a checkup with them and see if that training is available yet. And once it is, we'll make sure we get it over to the key members in this committee and this group so they can share with others. So that's kind of where we are. You know, this is a slow process, like I said, but the agency has prioritized implementing this bill. And I will say, for a Medicaid implementation, even though it feels slow on our end, this is pretty quick. So hopefully they'll hit those timelines for the enrollment later this year and the billing to begin later this year as well. And like I said, we'll continue to provide you updates as all of that is announced. So that is my update for you all for today.
Lori, thank you.
Yeah, definitely. Yeah, thank you, Lori. That was lots of great information. I learned new stuff too. So, can you go to the next slide? Oh,
Did you have another piece?
it had our emails on it, but that's
Oh.
okay.
Maybe we could add them in the chat.
Yeah, that works. Yes. So definitely reach out if you'd like to get added. Lots of great updates. There's more to come, especially on this bill that Lori mentioned, and we'll be discussing that during the work group meetings. And now for the subject matter experts and the community voice. Thank you.
Thank you, Iris. Really appreciate it. William Lyons, we'll pass it over to you.
So I'm William Lyons. I am the co-chair for Community Voice. And as you see on the slide, we have a variety of different partners or collaborators in this space from across a lot of different systems. And we're hoping that other people in the audience today will consider joining our group as well. Next slide. So a lot of our efforts thus far has been really working on trying to understand how the community experiences services. So we have one of our partners, CCPPI. They did a part 2 of a grant and completed analysis late in 2023, and were able to kind of publish or present findings to our work group. And so we've been really trying to digest that in the many layers there. The toolkit is available on our Google Drive, and I think soon it's going to be on the HEC website. So that's something to kind of look forward to. We are looking to have a workshop dedicated to those findings, just to give people a focused space to kind of start thinking about how they might implement some of the recommendations from that report. A lot of our work is centering on how do we present a framework, right? So the framework that works best for one agency may not work for another one. So we've been really trying to explore the different ones on this middle column here. So community engagement studio model, human-centered design, asset-based community development. We know that many of you in the audience might be using one of these frameworks to guide your own practice, and we will be working closely with the communications work group to invite you as subject matter experts to present to the larger collective. So please be looking forward to that, and hopefully a white paper to kind of align with that. And then last, we are really trying to highlight the integration of this work, right? So recognizing that it's great to kind of put on paper, it's great to kind of talk about in a meeting, but how do we operationalize this as a best practice in our work? How do we do this ahead of presenting a solution to the community? So we're also hoping to explore again, how other people are doing that, and hopefully share those results or best practices with the larger collective. Next slide. So based off the feedback we heard earlier today, we really have been trying to meet in person. So I think we've had at least 3 meetings in person. So in the picture you see to the left, we were visiting CCPPI space in 3rd Ward. The right on Emancipation, across from Emancipation Park. And so we had a great opportunity to kind of meet and kind of explore their space, but then also just have community and have shared space to kind of talk about and strategize some of the things. And what you see in the small graphic is part of the presentation we received. So how do people prefer to hear about new community resources? And so you'll see that most people look for social media. And so for those in the audience today who are thinking about, well, how I want to reach a new audience, what's the best way? Obviously, social media is a great way of doing that. Email. So if you do have an email listserv, continue to do that. Yet I will say, based to contextualize it a little bit, we also have heard feedback that most people hear information from someone they trust, right? So it's not just emailing just the email, it's making sure you have those key community health workers, those key leaders in the community on those listservs so they can help distribute that information to the people in the community. And so that's one thing we learned from that first part of the DASH grant. Next slide. So looking forward. So again, we're looking to develop a workshop coming in early fall. We're going to have a save the date soon. That's one of our meeting objectives for June, is to really think about the planning for that. Really looking to model it similar to what the Food Insecurity Work Group has done around stigma and some other things. We want to present like a self-assessment tool for people to engage with. So how do I know where I'm at? How do I then strategize where I want to go? And then again, we're hoping to have a networking session with the collaboration with the communications work group. And we do have a call to action. So I am seeking a co-chair for my group. So if you're interested in community voice and you feel like you can provide guidance and leadership, or is this an area where you want to learn and grow for yourself or your agency, I would love to have you as a co-chair. And then just another infographic. So here is how the type of resource you're presenting for the community, like what do the community think would best improve their community. And we see the highest around physical environment, right? So access to care, climate change, housing, transportation. So we know that the community is looking for that investment. They're looking for those resources to improve their community. I think that's my last slide. Thank you.
Yes, thank you so much, William. And I'll pass it over to the Food Security Work Group next.
Good morning, everyone. My name is Melanie McGuire. Again, delighted to be co-chairing this work group. My co-chair, both Hope and Maria, were unable to be here today, but do send their regards and have done a lot of work to really set the foundation for this work. Again, like William, want to pay a nod to all of the participating members currently that are part of this work group. They've been incredibly helpful to share their expertise and their insights as we kind of path a direction moving forward. Next slide. So to kind of go back a little bit to kind of highlight some of the work we've been doing, back in February, we held a strategy session to really talk about what are some of the goals of the Food Security Work Group? What are some of the areas that we want to really deep dive and focus on? And that really helped shape our learning in terms of some of the subgroups that that we've been able to form moving forward. And so it's been great to have such a rich conversation around food security And I think one of the key highlights of this is it's allowed us to really update our logic model, ensure that we are being inclusive holistically when we talk about food security and food systems. And so much of the participating organizations and many of you on this call today, I'm sure, can also relate and lend your expertise to this broader concept, as others have mentioned, the complexities around policy and our local food systems really help shape our understanding in the space. So we've updated our logic model to really take that community feedback and ensure that it is woven into our processes moving forward. And from there, we've been really able to form kind of three key work subgroups that we're calling similar to some of the other models we've seen in the other groups, to really like lean in and do a lot more deep dives. And then also pull from a lot of the expertise and research that we have within the Health Equity Committee to shape some of our understanding. So next slide. So here's a little bit of descriptor of the subgroups. We just shared this in our last meeting. So if you are interested in these subgroups, it is not too late to join. They're at the very top that you'll receive. There's a QR code here, as well as a link that will be provided. But what we're looking for is really active participation in one or many of these subgroups. And I'll just go through them kind of quickly here. Our learning series subgroup is one that we feel is critical to the foundation of this work. And we heard so many great topics back in February around areas of exploration. And so really this subgroup has an opportunity to kind of elevate some of that. We'll be working very closely with our communications committee to ensure that we are sharing out these learnings, as there's so many developments in the food security space, both holistically. So if you want to lend your expertise, some of the proposed topics in this group include some of the work around local ag and food systems, but there's a real variety of work that can be embedded into the learning series. And our goal is to ensure that we have active learning sessions and resources available for organizations. Our second group really centers around stigma. We heard a lot about stigma and just a lot of research that we could really be leaning on in collaboration with Dr. Kaplan and on the Healthy Eating Research Project. And so this group has a real opportunity to elevate some of the best practices around stigma and food insecurity training, particularly as we look at scale of this work embedded in community-based organizations and healthcare settings. Finally, there's quite a bit of work being done around mapping much of the work that's occurring in communities around food security. And so in February, you heard a great presentation around some of that mapping work that's being done, but we know that this work group can also help ensure that we're being inclusive of the numerous different organizations that are playing a role in this space, and really elevating that in this map to ensure that we have really strong coverage around some of the great work and projects that are occurring across Texas as it relates to food security and food as medicine programming. And so a lot of this work will really elevate this directory of various programs that are occurring in Texas. So all of these groups are available and we're anxious to have active participation. And we will also be looking for co-chairs for these work group subgroups. And so if you're interested in that, please fill out the link. All right, next slide. So as we mentioned earlier, some of the interesting research that's come out, so Feeding America, national organization of over 200 food banks, released its annual study that they call Map the Meal Gap, which really maps local food security and food costs, both at the census tract level and zip code, and also disaggregates race and ethnicity. And so just wanted to call out some of the work around the mapping that we discussed earlier, has some of this really great research around food insecurity rates in participating counties across Texas, as well as child food insecurity rates. You know, some of the research that came out of this latest annual study showed increased rates of food insecurity, particularly among Black and Latino individuals as compared to white individuals. We continue to see child food insecurity rates alarmingly high, over 20% in Texas. And so there's some really great data that is highlighted here. So we included the link here to be able to share this information. And we will continue to socialize some of this work as it pertains to some of the subgroups that we mentioned earlier.
Thank you. And a shout out to Dr. Ryan Ramphal for bringing this dashboard up for y'all. We'll have to look for some time to share that a little bit more broadly.
Great. So looking ahead, as we mentioned, we have some really exciting developments coming up here in June, including a presentation around Dr. Kaplan's work on stigma and food insecurity that we'll be sharing. So we love active participation, and we'll be sending out those links to participate in that meeting. We will be meeting with the subgroups and going over their goals and objectives and ensure that those align with some of the feedback we heard earlier. And then also, as I mentioned earlier, there's a great opportunity for your participation in one of these subgroups. And so information to sign up is included here, as well as a link that's provided. If you do have any other questions or information or would like to learn more, I will make sure I put my email in the chat and look forward to working with you all this year.
Thank you, Melanie. And with that, I will pass it to Lisa and Dr. Williams. And I know that we're running short on time. Dr. Williams, how do you want to handle the
video? I think we could put the video in the chat, and hopefully folks can get access to that. And I'll try to quickly go through that. I know there's a couple more presentations after mine. Well, first thing I want to thank Lisa Albert to really have joined our subgroup, our work group, and has just hit the ground running with her understanding of substance use and mental health conditions, and also just the work of our work group. We're really taking deep dives and having these really crucial conversations about stigma and what are some of the root causes. And so some of our work is really looking at stigma. That's what this slide looks at in terms of the impact, the emotional impact on people, both those that are giving or perpetrating the stigma and those that are receiving the stigma. And this presentation really goes into really the impact on the Black community. And that's why it says Black mental health matters. You can go to the next slide. And just want to go into some of the disparities. And when you think about the disparities, there is a correlation with the social determinants and non-medical drivers. When you think about social justice, poverty, housing, food deserts, folks being redlined, all of these impacts on the Black community. And it begins to show in some of the disparities. We look at blood pressure, diabetes, stroke, and the disparities in death rates and so forth. And so this is helps shape, the Black community in terms of how they're maybe not as trusting with institutions and so forth when we begin to look at the impact on the community. So if you go to the next slide. Right. This is very powerful. And when you think about social justice and you look at the disparities of Black men in particular, within the criminal justice system. If you look at the first line, it really talks about an estimated 7.9 Black males who entered the state or federal prison by the age of 20 compared to 2.8 Hispanic and 0.7 white males. And then you increase by age. And it's just, we'll just jump to age 40 and you see 26.6 Black males, 12.7 Hispanic males, and 3.5 white males will have served time. That's over a quarter of the Black male population. That is just alarming. There was a study that in a report done by Washington Post back in 2004, and it reported that roughly 14% of Black males within Atlanta, Georgia, were disenfranchised from voting because of felonies, and most of them were drug related. Can we go to the next slide, please? So, when you begin to look at 20% African-American adults are more likely to report psychological distress, it really comes shaped from those lived experiences. When Heidi showed the circle and the living conditions and the wheel, these are the living conditions that the folks are having related to the disparities associated with non-medical drivers. Can you go to the next slide? And that's why you have this slide here that kind of really illustrates, how Black Americans are distrusting in the medical field of institutions in general, related to the poverty factors, access to care. A lot of those non-medical drivers that folks are really struggling with in terms of disparities. And that's why you have some of the issues related to stigma, in terms of how Black Americans feel. If you go to the next slide, and it kind of goes a little bit into some of the emotional impact. And so there's a whole source of Black pride, and so a lot of Blacks will say, we don't suffer from mental health. I'm strong enough to handle it. And you think about the journey of Black Americans from slavery to Jim Crow to now, a lot of Blacks will say, well, my ancestors, dealt with it and struggled with it. Why can't I? And I don't need to ask for help. And so that's some real challenges with that, where folks want to keep it within the family. And also there's a strong connection with faith in the Black community. And so they feel that it's something to say about their faith, that they're not able to handle it through their faith or on their own. Can you go to the next slide, please? And so that's why there's these real concerns with Black Americans and seeking help. And that's why there's this stigma associated with Black Americans as far as being able to access care. Go to the next slide. Trying to leave some time for other folks. This is a video that'll be posted. It's kind of funny, but serious. I invite you to kind of look at it. It's very good. We can probably go to the next, and these slides go into the trust factors and so forth. I want to go to our updates. So our update, our group is really reframed, a lot of our priorities. We do still have the journey map and stigma that's going on, but we want to also focus on what we can do kind of now in terms of priorities. One of the things that we're going to be putting out is a survey. This survey is really to assess all of our organizations within the Health Collective about their work and trainings related to stigma reduction, but it's specific to different things related to social determinants, non-medical drivers. And so it's going to be very useful and information that may help shape what we do as a group or as a whole collective. So I just want to thank you all for listening to this shortened version of our presentation. Please look at the video, and hopefully we can spend a little more time with you about some of our work.
Yeah, thank you, Dr. Williams. I think I'd love to come back to some of this and spend more time in another session. And we do have a lot of other updates related to the closed loop referral and the community health worker efforts, but we don't have time to get into them today. So we'll share this out with everybody with the recording as far as those updates, and we will continue to put out more messages on the progress of what's happening. So look for more updates on those topics soon. We appreciate you all spending 2 hours of your morning with us. As you can see, just a ton of phenomenal work. Thank you to all of you who are contributing to making our communities healthier and promoting health equity across all peoples in our communities.
Yeah, do you want to put up the thank you slide? Heidi, I think I echo what you just said. I also want to offer us our time in the learning session in July, since there's an opening, to share out on the closed loop referral. I think it's important for us to give that update to the community. So communication co-chairs, you can sign us up for July. Thank you all.
Thank you, everyone. Have a great rest of your day.